Hi, and welcome to our emergency preparedness breakout session. You all just saw me and my co-presenter a few minutes ago in our last session, but we are excited to share with you about how emergency preparedness is so important in many different views and aspects. So I'm Sarah Gornick, along with my care partner, Truman. And I may need to get him set up on an iPad here really quick because I'm not sure how well this is going to go, but we're going to do our best. And I'm going to throw it over to you, Megan.
Hi, I'm Megan, and I am the CEO of a organization founded right here in Idaho called Raised for Rare. We bring uplifting support to medically fragile children and their families, and that's our mission.
And Jackie, welcome.
Welcome. My name is Jackie Fry. I'm the emergency manager for Twin Falls County. I'm also the mother of a 34-year-old daughter with Down syndrome, and I'm excited to be here today. So welcome.
Thank you. So Jackie, do you want to lead us off into your role and how you fit into emergency preparedness and the many amazing tips you have to share with us?
Absolutely. Absolutely.
You can watch TV.
I had my
My
daughter Nicole is 34, and of course, when Nicole was blessed into our family, she is the third of four of our daughters, and it really became a discovery about myself and the path that we wanted to lead to empower Nicole and to give her the life that she needed. At that time, I was actively involved in going to college and then became involved in our county and became a public information officer. And then it led into emergency management, which I've done for 27 years. I became very aware of the need for having food and water in the home and teaching families about preparedness, having those items they needed, having a call out list, having a list of their doctor's resources. But as a caregiver for an individual with functional needs, you start to really realize how incredibly important it is to have backup, to be able to find those resources and to really know what's in your community that you live in. And, I truly believe God blessed me and put me in this job because I began to see as the coordinator for our county that how important it was to know my resources, to work very closely with my partners, to understand sheltering and evacuation needs, and to really understand the needs of those individuals who would be placed into these shelters, but also to educate the caregivers, their parents, guardians, those individuals who were in their homes working with them, and giving them these resources that were doable, actually gave them those opportunities who are really needing to have these, I would say everything from, yes, the go bag and the go kid and all the numbers and everything, but really understand, because in a community, you can open a shelter. There's a lot of things you can do, but it wasn't until I was actively involved with the Oklahoma City bombing. I went into that after it happened a year later, and then got involved after Katrina and worked with the new transportation route and with their functional needs community. And then, of course, 9/11. And you start to realize the limited resources, and you start to realize the impact that those resources have on a family who's really homebound or has limited resources or needs. So through my county job, what you will find in my bio is I have done and created actually a useful link part of my website, which is twinfallscounty.org. And you just go into the department. It is going to be on the bio, but it'll give you incredible resources. But one of the things I kept having families contact me about and needing assistance with was putting together and manage financially, or even just being able to understand what they needed. So I created a 52 weeks of preparedness. So each week you would put together item that you needed to go in this kit, or however you chose to put it in your home. I have one in my car, a small one. I have one when we go camping, but I just started realizing those needs. Now, I started this, of course, years ago. So as Nicole has grown up and her sisters, I have 4 daughters. We started realizing, even as they've moved out of the home, we check the Go Kit. You should consistently rotate your food. You should make sure you have extra batteries in your flashlight, a battery powered radio, and all of these items, but they're not going to work for you if you don't periodically go in and really review those items, make sure the food is fresh. You're not maintaining meals in a sense. It's nutrition and hydration. So if you can do Ensure, you need to be very careful about your dietary needs. I encourage families to always create kits that are based upon their own dietary needs, their own health needs. You can purchase anything, but what you're going to find is you really won't use the food items as much as you would if you were creating these kits to support those people in your home that you need. And then the other part of this that's really important is know your resources in your community. All 44 counties in Idaho and our tribes have an emergency manager. Through Idaho code, there is one in place in each county. It's important that you really know who that person is. You contact them, and you really, just as you would when we had Nicole and we brought her home on oxygen, I contacted our local police department, fire department, said I have a high-risk infant in my home, and these are things that we really would need assistance with if something were to happen. So those things that are on the website, those things that you'll be able to look at and use for your own needs, really bring to light how important it is to always look at both your need base, but really those resources in the community that will be assistance to you during an event. And so I think I want to just be very careful on my time. I don't want to over.
I think we have we have plenty of time. So
okay, I know we have other speakers. And so, you really have to build it. But I'm involved in so much in my community as the emergency manager, but I have a passion for helping others. And I really believe strongly that when you empower people with knowledge, you give them that you encourage them, but you give them the tools to really be impactful and to represent themselves so that they really feel like they have some power over a situation. If there's a flooding event, or if they have to be evacuated, or they have to go into a shelter, that they really understand their need-based. They have a list of the items that they need. You have, in our case, medical records or copies of those things, copies of your bank accounts, or copies of pertinent information. Phone lines become inundated during an event. It's so critical that you have numbers to call out of state, believe it or not. Landlines that we had when we were children with the rotary dial phones are incredible because they continue to be used. Cell towers become inundated during an event. And so you really need to have those resources, but also understand what would be available. So a little bit, just to add a little bit to this, I have our amateur radio group as a backup communications. I have multiple church groups. I have multiple schools, multiple partners, so that we can be redundant and we can really move forward a positive outcome during an event. As the EM for the county, I am actively involved with those with functional needs. I'm involved strongly with our Office on Aging. I'm involved even with our weather service, so that I can put out to our schools information based on the chill factor, what's going on, because our college and so many different entities rely on our food, rely on our roads and the weather conditions to be able to be productive. So your workforce, anyone like that, but that's like my role. But as a mother, I have to tell you that I'm very, very proactive for Nicole. and that we are a certified family home. I think it's extremely important that we do our fire drills. We have a little evacuation plan. Yes, Nicole's been blessed with a mother who's running 8 cities, but that doesn't matter, because the truth is, it still needs to be addressed at all disasters start local, and we need to really address them. So whether I am who I am, I'm still a human being. I'm still a parent. I'm still a person who needs to be proactive on behalf of my child or my client or whoever. And the only way you do that is really reach out into your community to see what's available and what resources are there for you. I feel like I need to ask, and I know this is funny, but I give out a lot of information, and I think it's incredible the amount of people who have shown up today. And I really think it's important that if there are any questions or anyone needs to interrupt me, I would welcome that, because I really firmly believe in what I do, but I also want to project that I really care about this. And so if there's anyone who has a comment or anything, please feel free to ask me. So I wanted to, tell you that. I think as you get into the useful links and stuff, and you really look at the 52 weeks of preparedness, you'll see the amount of work that was done. But also, I tried to base it economically. So there's nothing you'll see. I rely a lot on my dollar stores. I rely a lot on, doing inventory in your home. Yeah, I see Lori says, what do we do if we only have one cell phone? So I think it's important, Lori, there are other programs that I know are available through Verizon and other retailers, I'm sorry. But other individuals, I was told in a meeting this week that there are free phones. There are ability to get some resources to help support you. So again, I think it's important, even if this is a track phone that you get at Walmart, and so inexpensively, you're able to get a phone that's an emergency backup. I think that's a critical piece of this. I have a lot of families that have said this to me, and that has been a really useful resource for them. They can get the phone inexpensively, and then they buy the minutes as they need them. So it's helped cut cost. And if you can't use a phone, the services in our county, the TDY services for the deaf and hearing individuals. And I think that's a critical piece here too, because a number of conversations I have are with providers, and how important it is that the provider really understands how they can support their client. And you need to really take that role very seriously, because there are resources. But if this person is dependent upon you for 24/7 care and needs to have those things met, then it would fall on the caregiver to help support that. And so you need to go out and really look at what are those resources and what is available. Many of you are from Boise area, from different areas of the state. And so it's important that you know what is available in your community. I look at trailers across the bottom of the TV, our radio stations. We look at our internet services as redundancy. If electricity goes out, then this is where my amateur radio group would step in. There's going to be other resources that we would use, but there are some threats to us that are very real and very frightening, very frightening. And so those are some of the things that you need to have the knowledge about and what is available. I don't know if
yeah, and I think this is Sarah, and I'll be presenting here in just a few minutes too. But I think one of the things that we came across when we were caring for my mother-in-law were the use of technology and other unfortunately, sometimes we have to pay for these systems and products, but for those life medical alert systems that a person can utilize, and where we ended up purchasing her an Apple Watch that the siblings could then use to help communicate with her. If she wasn't able to get to a phone, she had that technology on her wrist to be able to call anyone in case of an emergency. If there was someone who wasn't there, if there were breaks in care for a few minutes. But I know that Apple and iPhone aren't the only options out there, but there are some providers and some tools like that that can help ease some of the stress if we need to. I know there is an option on the Apple Watch that if you just hold the button down, it will alert emergency response systems, and you don't even have to call. So that'll actually call back to the phone or the watch and ask if you're okay, and then it has your location. So we've used that a couple of times in throughout our caregiving journey in many aspects. So but I would like to echo Jackie's comment in that if you are that care provider, being able to get out of some way of contact is on the care planning team to try to figure that out.
And excellent points. I went ahead, I typed very fast. I think you probably saw that. So I immediately put that in chat, but I do want to throw something else out too. When you go to my website, and it is under Department's Office of Emergency Management, you're going to see on the useful link page, everything from sandbagging to heating issues to addressing those with seniors, those that are diabetic. I have some very positive information. Nothing I do costs you money. Everything I do is free. So I'm one of the few things in life that you can actually glean from and use, and it is free. And I review the material and the websites very consistently to make sure that they're operational and that they work. But I would really encourage all of you. There's severe weather events. There's so many things. If you're traveling on the interstate, the 511, you name it, I've included these things just so anyone would have a one-page, I guess I'd say a one-page opportunity to get the information you need. The other thing is there's wonderful other resources out there through the care line, through other things that you can do. Again, it just takes some time, but when I hear I can't find something, then I think it's critical we listen. When something isn't working, I think it's critical we listen. I think the whole part of being successful in anything we do is really listening. We need to show some grace and some compassion and really care about those that we're not only serving, but those that are around us. When I go into senior centers and they want to do bingo, our prizes are a can of tuna, soup, you name it, and they always laugh, but they don't get I won't do the candy, and we do the stuff I believe that will encourage them to go out and plan during an event, having 72 hours worth of food, or if you can do more, things like that, being creative so that they feel successful.
That's great. Thank you, Jackie. I'm going to go ahead and throw it over to Megan Schomer real quick, and then we'll have some time at the end to ask more questions. And hopefully we cover everything and more that you wanted to learn about being prepared. But Megan, can you tell us a little bit more about how you help families?
Yeah, so our organization is a pediatric organization, and as I mentioned, we bring uplifting support to medically fragile children and their families. We do that through a variety of ways, the biggest one being community, which is going to tie into what I'm going to talk about. We have a large online community, support groups, family events. We also go in families' homes and do things like practical support, house cleaning, lawn care, snow removal, grocery delivery. We understand we can't buy time, but we can improve the quality of time families have together. And so that's a huge part of our mission. We also do a lot of advocacy work. So in emergency preparedness, in the healthcare systems, in legislature, all across the board, we're there to be a strong voice for this community. Something that sets our organization apart, I think, is that we are non-diagnosis specific. It could be one of almost 8,000 rare diseases, which include all forms of pediatric cancer, heart conditions, rare neurological conditions. Doesn't really matter to us what that condition is. If your child's on a complex medical journey, we are there to show up and offer support. So tying into the community aspect, Jackie's such a wealth of knowledge and mine is so small compared to hers. But as she said, connecting to your resources is so important. Your healthcare system, also being aware of your child's condition, obviously is important, but have hard conversations with your caregivers and your family and have them early and often so that everyone is on the same page as far as what you are going to do in the case of an emergency. And also put it in writing, have it available at all times so that when you are in that state of emergency, you have a clear plan to follow. Something I found, I actually had a medically complex child. He passed away in 2016. Which is where this whole organization came from. But we had an ICU in our home. And so we always would store away a little extra food or medication whenever possible, have everything we could at our disposal. That way, if there was a power outage or something, we weren't needing to leave. We were able to care for him in our home. And something about connecting to community as an organization, this community that we've built, and also with people within our community, business owners. There was a summer, two summers ago, there was a big power outage in Nampa, and due to our resources, we were able to get generators out to families that needed them immediately. And so they had access to all their medical equipment and their refrigerators. And one family had medication in the refrigerator. So we were able to help them retain all of their supplies. And that's just another reason it's important to stay connected to not just your community resources, but even nonprofits. We're very well connected to each other. We're connected to our communities. And if a need arises, we always try to step forward. This recent snowfall, we had several families trapped in their homes. So we sent snow removal out so they could get out and get to the hospital if needed. And also, so if they needed to call 911, emergency responders had easier access to their homes. So also churches are another good asset to be connected to and let them know what your needs are. And in case of emergency, that you need to be on the top of their list of checking in with. I think that something I found, this is a little off on the emergency thing, is advocating for yourself. My child was voiceless. So when you're in an emergency situation with a voiceless child, always being prepared. And that's why having your plan in writing is important when you have to go into a healthcare system, especially one that maybe you're traveling and you don't really know. You need to have a clear plan of who you are, what's going on with your child, and what your wishes are so that everyone's on the same page and your child receives the care that they need. And I think that's really all I have to say as far as emergency preparedness, but thank you.
Megan, could I ask Megan a question?
Yeah.
My fellow presenter, Megan, do you know who your EM is, your emergency manager?
I actually do not.
And where are you from?
We're in the Eagle area.
So, you do have an EM.
Okay.
And I believe it is, Ada County Emergency Management, and his name is Joe. Okay. And why I'm bringing this up is because Joe's an incredible resource. And the city of Boise also has an emergency manager. Joe Lombardo is his name. And his phone number, not to interrupt, but I'm just telling anyone, yes. His number is 208-577-4750. Every county in Idaho has a county EM. And it's critical that you contact them and you visit with them. They have a local emergency planning committee. See if they have that. Anything I do, I invite. I have a service providers group. I have a number of opportunities for people and our citizens if they choose to. Also, I did include my personal email. And then I did put the county website again down for all of you to see.
Thank you, Jackie. That's wonderful. Yeah, I would actually love to get that information to our families. We have almost 200 families on our services. Having them take that step and get in contact with those emergency managers, I think would be an amazing resource.
And
yeah, sorry,
No,
Jackie.
I'm sorry. I'm gonna let you. I just saw this. Somebody just said, please put in Joe. So and I'm sorry, Sarah, please talk.
No, you're good. I was just gonna say that when we're done, I will make sure that I put in the Padlet that I'm gonna show you how you can contact your county's emergency manager. That way you guys you'll have it and you can put it on your list of important numbers somewhere that we have in our home. But such a great information. I guess I'll finish up and then we'll open it up for questions. But for those of you who don't know who I am, my name is Sarah and I am the program coordinator at Idaho Parents Unlimited, and we are Idaho's Parent Training Information Center and Family to Family Health Information Center. And I know we've had the two panelists on here, myself and Megan, we talk a lot about children because the children's programs are our life, but we also know that caregiving goes across the lifespan. And for those of us who care for individuals with complex needs are going to be we're caregiving for life, just as Jackie is with her daughter. But we learn by mistake, and sometimes I've learned some of my emergency preparedness by mistake, by making mistakes. I'll share a little bit about my kiddo and our situation, and then some more about our organization. But my son Truman, who you met during the 12:30 viewing of the film, was born, he was a micro preemie. So we lived in the NICU at St. Luke's for about 4 months before we came home with an ICU attached to us, just like Megan and her son. We have all of the equipment, medical equipment, medical hospital beds, all the things you would see in an emergency room. But by mistake, we realized we were attached to electricity, and we needed electricity and our services to be able to provide care for him in our home instead of in a hospital setting. So we learned how to become prepared for any type of emergency by failure of not being prepared. And in fact, a couple of years ago, I believe it was 2018, when we had that, everyone likes to call it as the snowpocalypse here in the valley. My son he has a medical pump inside of his body that delivers medication to him through his spinal cord. And that storm happened to fall on when his pump needed to be refilled. And we had to get to the hospital to get that refilled. It's not something that I can do at home. It's actual procedure where medication is inserted back into the pump when it gets low. And so I had a panic moment because the day that storm hit was the day his pump needed to be refilled. And alarms would go off, and there's nothing that I could do about it. I relied on the hospital staff to take care of that issue. And so I was on the phone calling, hoping to either get it rescheduled or wait to move it into the afternoon when the snow kind of melted a little bit, to get us out of our house. We were stuck in our garage because there was so much snow. And so that really prompted us as a family and a community to take precautions so that didn't happen again. Fast forward, we ended up making it in at the end of the day, and our physician was very generous and kind to stay until we could make it. But we lived in Meridian and had to go to Boise. So we were stuck. And it ignited a little bit of a flame in me to be more prepared and to share with others in similar situations on how to rally up the community and make some of those I gotta shut the door things available for us. And so it wasn't a fun experience, it wasn't a fun lesson, but it certainly helped us be better parents and caregivers of our son. So when did someone have a question? Oh, sorry. Speaking of medication, when families call our office and they have questions about how to get services and need services for their kiddos, one of the things when we were talking about emergency preparedness is making sure that you and your care team have a plan for some of those medications that your loved one takes that you cannot stockpile. That it's a very, so my son has a rare seizure disorder, and so his seizure medication is highly managed and is I'm lost at a loss for words, but I cannot pick it up without a prescription. So, or without an ID, I mean. And so we get enough to get us through the month because it's a highly controlled substance. There's the word. And so coming up with a plan for your care team where you might need some of those controlled substances extra for your loved one. And that is a conversation that you may have to have with your insurance provider and your physician to allow that extra medication to be stored at the home. And there are I know that there are other non-controlled substances, but that fits into, but it is an important conversation to have when those life-saving medications are needed to be given. And so we have a few days worth of medication that we can give our son, and that it's saved and safe. And then again, we have to rotate that because it does expire. So those are some things that we have to take into consideration when we're planning for an unforeseen emergency, like we had. And then, so I'll back up just a really quick minute and talk about who we are as the Family to Family Health Information Center and Parent Training Center. Every state has a Family to Family Health Information Center, and we're funded in part by the Health Resource Administration, specifically the Maternal Child Health Bureau. And what we are tasked with is providing resources and information for families who have medically complex children, or a disability or a very special healthcare need. And so we help families navigate through funding, how to pay for their children's care in the home and in the community. We are a family-led organization. We are the families we serve, and so part of our responsibility is to have more than 51% of our staff be the family caregiver or family member of a child with a disability or a special health care need. So we really are down here living the lives that we are helping our families. We're the Parent Training Center, so we help families navigate special education and those services in the school system and understanding how to navigate those programs. We are also very well connected to our partners within the community in all of our areas. And so being able to collaborate through some of these conversations about how to be the caregivers of our loved ones is very important to us as an organization and us as individuals that work there. I am going to share my screen real quick and show you a Padlet that I have created, and that has a lot of information on it. It also has links to Jackie's emergency, or her page that she shared, and then I will have Sarah and Jennifer email this out as a resource, or put it on the caregivers page. But I would like to just say really quick, I know that we are the children's organization, but we are also linked to our Centers for Independent Living in each of the regions of the state. So up north, you have DAC Northwest, and then over in the east, you have Life Incorporated. And so those and in the Boise Treasure Valley area, we have Link. Living Independent Network Corporation. And those are all the Centers for Independent Living that also provide this similar resources as us for children, but for adults. We serve families birth to 26, and those Centers for Independent Living focus on 18 and older, and planning and independent living for everyone else. And so we work very collaboratively with all three of those organizations. But let me share my screen and show you what I have created for you all. This is a Padlet, and what a Padlet is just basically a customized kind of a dashboard. If anyone's been on Pinterest, it's similar to Pinterest, but we use it to share resources at our organization, and it's free. And so what I've put on here is Jackie's 52 weeks of emergency preparedness. Also a link to the twinfallscounty.org page that she has put in her bio. Some other things that I thought were very important, I also put in Raise for Rare's website. Some things that I've also learned along the way is notifying anyone who's going to come in contact with my son, his emergency, his disabilities or health concerns. So I put in here a template medical alert card. I saw in the chat that there was a certified family home emergency rule. I put that over here as well. And then if anyone has anything that they would be a good idea to put in here, I'd be happy to add that to the Padlet. And this, you don't have to have a password or anything to access this website. And as we learn more, we'll add things to it. But FEMA is a great website for emergency planning. There are also other programs where you can put things in your window to alert neighbors or emergency response teams that come to your home, that you might have someone in your home who's nonverbal or who has seizures, or if they're home alone. And I'll put that link in here as well. So what else was I gonna say? I think that's really, I just ramble sometimes when I run out of things to say. So I'm gonna open it up to questions. And I think what I'll do is I'll stop sharing and then we'll just open it up. We've got about 15 or 20 minutes left to kind of have a conversation about what you've done, if we've not said anything, or if you have any tips. I'm gonna copy some of these things and put that in the Padlet. So
Mapping your neighborhood is something else that's on my page, and that can be done in a neighborhood, no cost whatsoever. It's really unique.
I love that.
And the FEMA training, I will tell you, is also free, and there's a number of courses on there. FEMA.gov is one of the best sites you could go to.
Absolutely. They've got like templates for plans and stuff on there.
Absolutely.
It's
And
great.
that's on my page also. So yeah, take whatever you want.
I'm going to reshare that link to our Padlet too. Everyone's so quiet. I'm hopefully going to, yes, I'm going to see if the organizers of the Caregivers Conference can send this out in their correspondence via email after the conference is over. If not, it will probably be housed on the Caregivers website, but we'll make sure we get this out to you all so that you don't have to go searching for it. Of course. Has anyone had success with their insurance for allowing extra medication? We've had to really state our case on why it was needed. And of course, they don't give you like a full month's worth of extra medication. But at least 10 days is what we have been asked, what we asked for. And so it takes some time. And sometimes our physician has to write a letter stating the necessity. And then, we also have dual coverage. So we have, my son is covered under his dad's insurance. And then we also have Medicaid as a secondary payer for that. And so having conversations there between everyone and making sure that everyone is on the same page. One thing I didn't mention was that our medical home, if you have multiple providers that your loved one sees, making sure that you have a medical home. Sometimes our medical homes also have, and let me back up and define what a medical home is. It is not a home full of medical equipment, which is what I thought it was when I first heard the term medical home. I'm like, well, of course I have a medical home. Everything's in the home, and I feel like I have a hospital in my house. That's not what it was. A medical home is you have a one central location, which is generally your PCP or your care provider, primary care provider, who houses all of your documents and all of the information about the patient, and then where all of the specialists come and send their information. So our medical home right now is our pediatrician, and that pediatrician also has a care coordinator. And sometimes those care coordinators can help facilitate those conversations between insurance companies, Medicaid, and the physicians and pharmacies to try to facilitate some of that extra medication. If that is a very long answer to your question.
When I was caring for my sister, she had pain medication that she really needed, and we were able to work with everybody to get a week's worth that we kept in reserve. And when we got the new refill, I took the meds out of our runaway kit, we called it, to cycle that back through and filled it with the new prescription so that it was always fresh with each refill.
Awesome. How often do you rotate? Well, I don't know if there's, I know there's
rotate food?
Yeah.
So actually the key to rotating food is, what I do with food is look at the cans every 6 months. I go through my stuff. If you have rusted cans or bulging cans or anything like that, you should rotate them. Water anymore, because of Nicole's inability to, pick up a gallon and stuff. I get water that is in, of course, smaller bottles and stuff. Most of the water it's pretty amazing the length that you can go on storing some of this. The biggest key to this is on putting in a kit for food. You need to always keep in mind something. It's 3 gallons of water per person per day for hygiene, consumption, and food preparation. And as you get older, you may modify that. You may put in your kits that you're going to have, ensure you're going to do something else. But when you have a family and stuff, you want to be really, you really want to educate yourself about what you're putting in. I never put candy. I never put things that I had to cook in the sense of macaroni and stuff. Some do. I did it for a reason, and it's because it required me to have matches and other things. And yes, I had them, but I didn't really have, it wasn't a priority to me. Because I would do tuna, I would do fruit. There were other things I could do to compensate or make sure we had nutrition, hydration. But my husband now had gotten quite ill, and he's now diabetic, dependent on insulin. So you have to be extremely careful with dehydrated fruit, anything with high sugar content. And that's one of the keys about putting together your kit. You really have to look at your own dietary needs. You have to be very cautious about what you can do and what you can eat, because you don't want to be part of a medical issue when you're simply trying to survive during an event. So, people, when they put them together, I've seen some incredibly creative things. One of the most dangerous things that I saw was people that were putting a roll of toilet paper in a quart or a gallon can, an empty paint can, and pouring alcohol on it and sealing it and then lighting it on fire and using it. They give off carbon monoxide. Our fire department went crazy with this. And I had a family that brought their barbecue grill into the kitchen and not only almost caught that, well, they had their own severe issue with that. But you never put something in your home that states very clearly it should be kept outside. 55-gallon of water barrels at Costco, the blue barrels weigh about 3-4 pounds empty. Filled, they're well over 400 pounds. You have to be careful where you put them. I had families that put them, they froze on the side of their home, or they put them in their bedrooms. They did all of these things and then were panicked because they had no way of getting them out. And
Gosh.
so common sense is a huge part of preparedness. And I don't say that because I'm making fun. It's not that. It's that people do what they do because they either look at it as a financial, they're frightened and they want to be able to maintain what they need, but financially they can't do it in the manner they should. And so someone talks them into buying the $75 kit that has got enough food in it for a month, but yet they can't eat it. So the really important part that I've found is, you know, a can opener and making sure you have your flashlight and batteries and making sure you have food and you're rotating it and making sure that you're taking into account your physical, emotional, I mean, why I say emotional, coloring books, you name it. I had families, I said to them, I used to do classes and they build their kits. You know, I taught school and I'm going to tell you there's nothing more enjoyable than feeding sugar to a classroom of 5-year-olds. And during a stressful time, our bodies react in a number of different ways. I had people that would pack a lot of sugar and a lot of, you know, water and then Kool-Aid and all these things. But what you have to educate people about is this is for hydration and nutrition. You need to make some good choices. One of the neatest things I do for a makeshift toilet very quickly is I take a swimming noodle, and you slit it down and you put a 5-gallon white bucket and you can fit it over the top as the seat. And you use your hand wipes and you have some gloves and you have some garbage bags and you can fit everything in there and pop the lid with the handle and carry it. And then you just literally put the little noodle inside it when you don't need it. And then when you need it, you just sit it around the thing. You know, these are things that you're going to use not every day, but during an emergency. Then you take your waste and you can seal it up in the bag, put it, you know, maintain it until you can properly dispose of it.
Yeah.
So, and then the final thing I'll say is pets. You have to maintain the care of your animals during an event. Yes, I have, and we'll work with our shelter and different people, our pet shelter, but it is critical that animals be maintained. During Katrina, it was the saddest thing I've ever seen to see that many house animals that were so traumatized they became a threat to the first responders when they were trying to go and support an injured or a fatality. It was terrible because these animals were so traumatized from the hurricane and from the issues that they were roaming. Then it was terrible. They became a nuisance and they became a problem because they were no longer domesticated. They were feral,
Yeah.
threatened animals.
Thanks for reminding us about our furry loved ones, because we, you know, I think we are so our heads are down and we're focused on our humans, but yes, our furry loved ones are definitely part of the family, and making sure that they are well cared for. They are our support, right? And so if we don't take care of our support system, there, especially in a time of unease and yeah, thanks. I just went right over my head. And one of them's in here right now sleeping. So many great thoughts and comments in the chat too. Thank you. Yes, Steve mentioned that the pool noodle is a great camping hack. And sometimes when I think about being prepared for emergencies, and some of the things that we've learned through church and whatnot, is that a lot of the things that we prepare for an emergency are what we already take with us when we camp, depending on how you camp. But yeah, so thank you. Kind of goes back to that common sense, right? I think sometimes we overthink things and get in our own way. And so
One final comment on the medications.
mhm.
Nicole, we kind of had a mess up with her thyroid and stuff. Our pharmacist in our rural community gave us 10 days of her thyroid medication while it was going through all of the gray area. I'm going to say it like that. You know, as an emergency manager, I work with our health department. We have agreements with our pharmacists so that if something happens in our community, we're able to sustain someone's health and get them the medication they need. We had a hostage situation in our area. We had a gentleman who was a diabetic, and we were able to, with the help of our paramedics and with the help of our health department, be able to work with a pharmacy to help him because he was actually being held hostage.
Wow.
And that was the only way the law enforcement could get in the medication. So, you know, again, at the very beginning, when I said, find out who your EM is, it's really important that, I'm going to speak on behalf of my EMs. We took a role in a job, and I think it's critical that we step up and we really look at what that role is and the responsibility to each of our citizens, regardless of what and who they are. It is our responsibility to care about them. And I deeply want to thank all of you today for welcoming me and listening to me. Thank you. And Megan and Sarah, God bless all of you. Thank you.
Thank you. And I just put in here the Idaho Office of Emergency Management website. That's
Yes.
how you can locate your county's emergency management system. So I'll include that in the Padlet. If I'm sure Jackie had it already in hers too.
It's the web EOC. They're all listed, phone numbers and even pictures. But you contact that website. Good people, good people. I know
Yeah.
Christina very well. I know Joe. Good people.
Thank you. I'm gonna add that real quick as we're speaking. Any other closing thoughts or questions? This has been informative to me for sure. Online training, is that for Jackie or Sarah or Megan? The pool noodle gal. Jackie, that's you.
Oh, the pool. I'm sorry.
That's awesome.
Do I do training? I do so much public speaking and training, and it's free. You know, I will tell you that I have a lot of counties that request me, and I have to be very courteous because I can't overstep by going into another county unless their coordinator gives me permission. I am over 8 cities for Gooding and mine in Twin Falls County. I do work with the Office of Emergency Management a lot. They know me well. But I will tell you, I do a tremendous amount of training for all ages and for all individuals, regardless, regardless. I will tell you, I'm wide open to educating anyone. I think it's just, I mean,
It is.
I love it. That's what I do.
You can never be too prepared.
No, I've had my share of mistakes. Thank you.
Yep, I'm sure we all have. Yeah. And that's how we learn best, unfortunately. We don't want to repeat that mistake, right?
Absolutely.
Well, I will again remind you that I will send out that Padlet link again, and the website Jackie shared separately, even though it is in the Padlet. I'll share all of that out for you guys again and have that sent via email to everyone who attended the conference. I do know that we were instructed to, as we leave here, to tell you to leave the room and not leave the conference. I think when you go to leave this session or this breakout room, sometimes we can accidentally leave the conference. I've done it. So anyway, I hope you all get started on making sure you have 72 hours of emergency ready at the go in case we do have another incident or a community incident, and I'm crossing my fingers and saying my prayers that we all don't have to go through that, but we can't predict the future. So thank you. Thanks, Megan and Jackie.
Thank you.
Thank you
Yeah.
for having me. Thank you
You
very
bet.
much.
And we'll see you all around the rest of today, and thanks for coming.